Hey YouTube, I'm back with safety, communications, and record keeping slides from my school. Hope you all enjoy. I'm gonna go over them real quick for you. This is for my intro to respiratory therapy class. Sorry, I printed off kind of different, double-sided, so it's harder to, just a little bit harder to navigate than the other way around. Body mechanics, lifting posture, straight spine, use of leg muscles, moving patient in bed. Most respiratory patients prefer semi-Fowler positions. Get help if possible. Place bed in low position. Place all equipment close to patient to prevent dislodging. Boost PT up in bed. Arm under near shoulder and other under other shoulder. Have patient bend knees to help push themselves. Move on the count of 3. Electrical safety. Physiological effects of current, amount of current flowing through, duration, path the current takes. Electrical safety. Ground outlets, 3-pronged adapters, inspect cords, routine biomedical equipment, checks for electrical safety. Fire hazards. For fire to start, 3 conditions must exist. Flammable material must be present. Oxygen must be present. Flammable material must be heated to or above its ignition temperature. If you remove or eliminate any one of these conditions, a fire will not occur. Fire and oxygen. Oxygen is non-flammable, but it greatly accelerates the rate of combustion. Burning speed increases with an increase of oxygen concentration. Minimize fire hazards with oxygen usage. Sign outside room, no smoking or oxygen in use. Remove any flammable material. Most important in enclosed tent or hyperbaric environment. Petroleum jelly not to be used. Static electricity try to minimize. Race. Rescue the patient, alert others, contain the fire, evacuate patient. That's what RACE stands for. Pass. Pass stands for pull the pin, aim the nozzle at the base of the fire, squeeze the handle, sweep from side to side. Initiate rescue after discovering the fire. Pull the fire alarm to get help from others to rescue patients. Turn off oxygen zone valves and close doors to area. Limit risk to other patients in adjacent areas. Why is it important to communicate in healthcare? To establish rapport with another individual, colleague, or member of the patient's family, to obtain information such as a patient interview, to relay pertinent information as when charting the results of a patient treatment, to give instructions as when teaching a patient how to perform a pulmonary functions test, to persuade others to take action, as when attempting to convince a patient to quit smoking. Factors affecting communication: sender and receiver. Sender: attitudes, values, experience, culture, self-concept, listening habits. Sender and receiver. Sensory emotional factors. Sensory emotional factors: fear, stress, anxiety, pain, mental acuity, brain damage, hypoxia, sight, hearing, speech impairment. Environmental factors: lighting, noise, privacy, distance, temperature. Verbal expression: language barrier, jargon, choice of words, questions, feedback, voice tone. Nonverbal factors: body movements, facial expressions, dress, professionalism, warmth, interest. Technique to improve communication skills: sender: share information rather than telling, seek to relate to people rather than control them, value disagreement as much as agreement, eliminate threatening behavior, use effective nonverbal techniques. Receiver. These are techniques to improve communication skills. Techniques to improve receiver communication skills: work at listening, stop talking, resist distractions, keep your mind open, hear the speaker out before making an evaluation, judge content, not on delivery, maintain composure, control emotions. Providing feedback: attending, paraphrasing, requesting clarification, perception checking, reflecting feelings, reflecting feelings, providing feedback. Minimizing barriers: use of symbols or words, different value systems, different perceptions of the problem, emphasizes on status, conflict of interest, lack of acceptance of differences in points of view. Conflict resolution: competing, accommodating, avoiding, collaborating, compromising. Conflict resolution. Competing, assertive and uncooperative, power-oriented, accommodating, unassertive and cooperative, neglect their own needs, useful strategy when it is essential to maintain harmony, avoiding, unassertive, uncooperative, may be appropriate strategy if there is no possibility of meeting one's goals or both parties are hostile. Collaborating, assertive and cooperative, parties try to find mutual satisfying solutions, takes more time. Compromising combines assertiveness and cooperation, used when quick resolution is needed. However, both parties often feel they are losing. And compromising. Doug's golden rule of conflict management. It is best to have full picture with all the details and information before you confront the issue or problem at hand. State the issue in a calm manner, being as truthful and factual as possible. Your emotions will cloud the issue as to it being personal problem of yours as opposed to the real issue at hand. Choosing civility, the 25 rules considerate conduct by P.M. Forney, co-founder of the Johns Hopkins Civility Project. P.M. Forney, choosing civility. All right. Acknowledge others. Think the best. Listen. Be inclusive. Speak kindly. Don't speak ill. Accept and give praise. Respect even a subtle no. It's a Hopkins Civility Project. John Hopkins Civility Project. Respect others' opinions. Mind your body. Be agreeable. Keep it down and rediscover silence. Respect other people's time. Respect other people's space. Apologize earnestly. Assert yourself. Avoid personal questions. Care for your guests. Be a considerate guest. Think twice before asking for favors. Refrain from idle complaints. Accept and give constructive criticism. Respect the environment and be gentle to animals. Don't shift responsibility and blame. Record keeping. If it isn't written, it didn't happen. Record keeping is really important in respiratory therapy and the medical field in general. The medical record or chart presents a written picture of occurrence and situations pertaining to a patient throughout his or her stay in a healthcare institution. Medical records are the property of the institution and are strictly confidential. Medical record is a legal document. Medical record is a legal document. Record keeping general rules. Entries on the patient charts should be printed or handwritten. After completing the account, sign the chart with one initial and your last name and your title, RRT. Institutional policy may require that supervisory personnel countersign student entries. Do not use ditto marks. Do not erase erasures. Provide a reason for questions. If made, a single line should be drawn through the mistake and work error printed above it. Then continue your charting in a normal manner. Record after completing each task for the patient and sign your name correctly after each entry. Be exact in noting the time, effect, and results of all treatments and procedures. Record patients' complaints and general behavioral. Describe the type, location, onset, and duration of pain. Describe clearly and concisely the character and amount of secretions. Leave no blank lines in the charting. Draw a line through the center of the empty line or part of a line. This prevents charting by someone else in areas signed by you. Use standard abbreviations. Use the present tense. Never use the future tense, as in patient to receive treatment after lunch. Spell correctly. If you are not sure about the spelling of a word, use the dictionary at the desk to look up. General sections found in a patient's medical record. Admission sheet. Record pertinent patient information, name, address, religion, nearest of kin, admitting physicians, and admission, diagnosis. General sections found in patient. Admission sheet, history, physical, physician's orders. History and physical records. The patient's admitting history and physical examination as performed by the attending physicians or residents. Physician's orders. Records records the physician's orders and prescriptions. That's part of the admission sheet. General admissions. Progress sheet. Keeps continuing account of the patient's progress for physicians. Nurse's notes. Describes the nurse's care given, including patient's complaints, the nurse's observations, and the patient's response. Medications. Record. Notes. Drugs, IV fluids are given to the patients. Vital signs graphic sheet. Record the patient's temperature, pulse, respiration, and blood pressure over time. IO sheet. Records patient's fluid intake and output over time. Laboratory sheet. Summarizes the results of laboratory test. Consultation sheet. Records notes by physicians who are called to examine a patient to make a diagnosis, surgical or treatment consent. Records records the patient authorization for surgery or treatment. Anesthesia and surgical records. Notes key events before, during, and immediately after surgery. Specialized therapy. Record progress notes. Follow sheets. Records specialized treatment or treatment plans, patient or progress for various specialized therapeutic services. Charting using SOAP format. Subjective information obtained from the patient, his or her relative, or a similar source. Objective information based on caregivers' observations of the patient, the physical exam or diagnostic laboratory test. Assessment, which refers to the analysis of the patient's problems. Plan of action to resolve the problems. And that's it for the safety, communication, and record keeping. Hope you all enjoyed. Catch you on the next video. Have a good one. Bye.